Hi guys, we are at Laugh and Learn. My name is Fiona,
My name's Trisha.
and we are an ABA therapy clinic in Grand Blanc, Brighton, Michigan, and we are going live to answer any questions you guys might have about autism or ABA therapy and to just share some information that might be useful for our community. But we're going to start off really quick. A huge issue sometimes that parents or families run into is if they have an autistic child, they might like to take off. And we kind of call that eloping. So when they're running away. So there can be multiple reasons why a child might elope, but we're going to just do a quick demonstration to show how you can handle a kiddo eloping in a safe and just the best way possible. All right, I'll be the kid.
Where do you want to go?
Bowling.
Let's go!
All right. So she'll give us a little bit of a rundown of why it was handled the way that it was handled. So we saw a little bit of physical contact, but we also did see a prompt for asking again where I did want to go.
Yeah, so a few things to be mindful of. If you have a child that responds to stop, that's always a good one to throw out there before, you may help them, guide them back to where they were seated. We just want to be careful if a client is running or a child is running that we're not pulling by the arm, right? That puts a lot of pressure on the joints. It can not be the safest way to guide them back. And other approaches to do as well is, if they're sitting, it's positional. Making sure that you're positionally in a good spot to block. So if you know that your child really likes water and there's water behind you and you're sitting at a table, you can make sure you're between them and where they might run to, whether it's a door, the front door, or a fun activity around them. And that way you can kind of stand up and have them ask first. If you have a child who loves to be chased. Yes, I know that they're out there, right? A lot of kids just love that. Something that you can do is make sure that they're still able to get that in more of a structured way. So have them request, hey, chase me, making sure that you're giving them opportunities to be chased at different parts of the day where it's more safe, and you can just make sure that you're in a place where they're not going to run too far away, maybe your backyard, but they can kind of get out those fun feelings of being chased.
So then what would you say is a reason why some kids might elope?
Yeah, so there's a few different reasons, right? Wherever they're running to, they might be really excited to get to. They might not be quite happy where they're sitting. They might be running from less desired activity or a task. They might be running towards whatever fun they're running towards. They might be kind of looking to get that big reaction from the other person who's in the room with them. So if they're running out the door, right, a lot of times we're like, oh no, and that frantic. They might find that hilarious, right? So it might be partly for that, what we call more of that attention component. They're seeing how we're going to react or respond to their elopement, which might be kind of a large response, and they might think it's funny. They might also just love running. A lot of our kids love that sensory input of running. So again, providing them ways that they can do that still, but more in a safe space. But if they're running towards things, we want to ask them where they're going, and have them ask. If it's more of a sensory component, allowing them to have a time where they can run freely. If they're running from the task, right, we can have them request to be all done and really work on some of those functional communication skills.
So what would you say really leads, making like blocking and kind of prompting for that communication definitely helps in the moment. What helps that to be a sustainable goal that they're not running in the future?
Yeah, if you want to look at, when you're looking at any intervention, you want to have some of those proactive strategies and reactive strategies. So if we're able to block and prompt them, great, awesome, but sometimes they're just too fast, right? They take off. Something that you can do is you can guide them all the way back and have them ask again and then allow them access. You can have a multitude of consequences, what you feel is appropriate for your child. Maybe they don't get access to going to that area that they want until they show you that they can walk safely somewhere else. Maybe you go in with, maybe they hold your hand, you work on holding hands without eloping, and then you work on them standing next to you and not holding hands without eloping. So there's a few different techniques, but some proactive strategies, right, is if the individual is looking like they're going to elope, right, we can block, we can remind them, hey, let me know if you want to get up and go, and we can. So those are some tips there.
We got a question. What tips do you have as a newly certified behavior analyst to start working in the field?
That is a great question. A big thing I would say is know that it's going to take a while to feel very confident in what you're doing. You learn so much when you start your career as a behavior analyst. You're going to work with so many different kids, and they're all going to have just different individualized components to treatment that you kind of have to navigate. Know that it's such a rewarding job, and I'm sure you're already been in the field if you are a behavior analyst because you've had to do your practicum experience. But I would definitely give yourself grace, collaborate with the parents. That's so important to understand what they're seeing at home, and just really supporting your technicians.
I love that. That's awesome. I think Ryan just became a BCBA too not too long ago, right? Yeah, so that's always an exciting transition. Congratulations, and we hope things go well for you. Yeah, so once again, feel free. If any of you guys have any questions, anything related to autism or ABA, throw it out there and we'll give you guys an answer. But in the meantime, kind of returning back to a little bit of that eloping, what I gathered from, what you're talking about is reinforcing the appropriate way to get what you need without eloping, running away, doing something unsafe. That's always the goal here in ABA, is to keep our kiddos safe and to ensure that they have safe ways of communicating and getting what they need and what they want. And so that's just kind of the goal here. Switching topics a little bit, we know that attention spans can be difficult sometimes for children that have autism. Every kiddo is different. Every child is going to have a different attention span, but ABA can work on strengthening that attention. What are some things that we do in ABA to help that?
Yeah, so we look at a lot of those visual perception skills, and we use the client's unique, or not unique, but their interest, right? So you want to start with preferred items and see, hey, can they track those items? Can they visually track you moving those items and attend to it for a few seconds? That might be a starting point and an ending point, right? Might be them navigating through their AAC device, because usually there's different folders that you have to navigate. There's a lot of different icons that they can select. But there's a lot of different strategies getting there, right? We might work on attending with puzzles, or other visual perception skills to just kind of increase their time of looking at them.
So we have a question. Someone stated that their 4-year-old daughter just got diagnosed and they're not sure where to go from there. What would you suggest is that those first steps in that pipeline?
Yeah, that's a great question. So when a child is newly diagnosed, a lot of times in their diagnostic evaluation, they'll give some recommendations too. Those are extremely helpful. A lot of times there's information on there for when they get into school, their IEP, other services, not including ABA, but also OT, PT is recommended, physical therapy, occupational therapy, or speech therapy. I recommend touring different facilities. So that's huge. We offer tours here. We encourage the child to come in and kind of see this environment to make sure it's going to be a good fit for you and your family. You want to ask the right questions, and that's something that we provide during our tours too, is a tour questionnaire. So if you're touring other ABA facilities too, these are the questions we would ask, just being experts in the field. While you're waiting for ABA services, because it sometimes can be a little bit of a lengthy process, I highly encourage getting plugged in with those other services like occupational therapy and speech therapy, and physical therapy if it's recommended.
Mm-hmm. And let's say if they're kind of at that point where they might be starting school, how can they kind of coordinate with the IEP team? Let's say they're on the wait list for ABA services. Is there any kind of tips you have for coordinating in that way?
Yeah, so sometimes even waiting for ABA services, they can still do parent trainings. They can do an authorization for that if you're open to it, and they can help support you during those IEP meetings. Just to make sure that, you know, everyone's kind of on the same page, you feel supported, and maybe give some suggestions. Or if the IEP team is asking the BCBA for suggestions, it's just an opportunity to collaborate. Something else while you're waiting for services, right? Communication is huge, and whatever that looks like for that learner. So maybe if we're not pointing yet, we're just pointing. If we're hand leading, okay, maybe we're going now to having them point before they get the item. Just really encouraging that communication and having that more as the expectation will really help that learner know that's what they need to do to communicate with others, and you see that communication kind of take off or at least increase. So.
Yeah, a lot of stuff that like happens in the clinic and that we teach in the clinic needs to be reinforced at home irregardless. So you can also just start with informing yourself on what ABA is, how it's applied, and see what of those pieces you can kind of put into your home life even before you start those services. Someone said that their school is trying sign language. She's kind of nonverbal, but she tries to talk. I'm not sure. So yeah, what about the language piece?
Yeah, so that's a really great question. I think I felt the same way when I was new in the field with, oh, well, if that child has any vocal verbal language, if they're talking at all, we should really just focus on that. But I was wrong. In speech path, there's lots of research that supports having the child learn different communication forms is just going to help develop their language. So sign language is great if your child has that fine motor capacity to do some of those signs. That's a great way, and you can always still model that vocal verbal language. So if you're doing, you know, more please, right? You verbally say that whatever they're requesting for. So if they're saying all done, you would say it with it all done, and if they say it vocal verbally and not with the sign, we would always honor it, right? So sign language is very, very helpful for a lot of our kiddos. So
yeah. And I'm honestly not sure with like in the school and with the IEP. Oh, sorry, she said something else. She does try sign, and I do talk to her. I'm trying. Yeah, well, good job trying.
Yes.
That's the most important thing.
Yes. And narrating. So for some of those kids that are on the cusp or even nonverbal, sometimes just narrating what they're doing. So maybe they're playing with a doll and they're brushing the hair, and you're like, wow, you're brushing the hair. So you're just consistently pairing that language with her. But go you, as much as you can do at home with pushing that communication, the better. So
that's awesome. Yeah. And I know some of the things like with modeling the, you know, correct communication for things like that and honoring as much as you can whatever communication attempts they do make. Like I know there was an example that was in like one of our papers somewhere where like even if you're like your kiddo's requesting for like juice, for example, but they don't get the full word juice out, they just get maybe like juice. Like to try and appreciate, recognize, acknowledge that attempt and be like, oh, juice, you want juice. And so to kind of encourage that communication can be a really great way to just, I mean, everyone likes to be appreciated, and that makes you want to work harder, you know?
Yes, and just meeting them where they're at, right? That is so huge. Meeting them where they're at and just slowly trying to work towards maybe that desired response. So that was a great example, Fiona.
And I'm kind of curious too. I'm not sure if you're like looking into AAC devices at all, but just kind of for all the parents out there, how do you get provided with an AAC device?
Yeah, that's a great question. So speech pathologists are the ones who put in that request through insurance. So they can either do that if they're a school SLP or for private insurance, or not private insurance, but private SLP services. They do a certain assessment to make sure that it is a good fit for the client. So with any mode of communication, like we talked about sign language, right? You have to have some fine motor skills. You probably need to have some imitation skills so someone can teach you how to do sign language. And same with the AAC, right? You have to be able to attend to a lot of different pictures and kind of navigate that. So there's a few different prerequisite skills that they look at to make sure before investing in an iPad or a tablet for the system that it's going to be beneficial for that child.
Yeah, that makes sense. And so if a child does get an AAC device, how is this handled in the school and then at a potential ABA clinic?
Sure. So collaboration is key, right? We lean on some of the speech paths a lot on, how to navigate the AAC in ABA therapy, but a lot of times we heavily work on that communication, whatever mode that is. So if a client is using an AAC and it's brand new, we might do a lot more modeling. So if they're going up to the trampoline, we might model, oh, you're going on the trampoline. Mm-hmm. And then we might, physically prompt the child to click trampoline as well. If they're open to it, if they're resistant to pointing, we're just going to keep modeling and, showing them where that's at in the AAC device and what it sounds like. And usually with the AAC, if you click on an icon, it also will say the word and then you can model it too.
She said that she doesn't know sign language, but it was just struck her as odd that the teacher was trying to use that. Is that, what might be some of the benefits of using sign language, I've seen it sometimes even with non-neurodivergent kids, like just your neurotypical kid, sometimes teaching potty or something like that can be really helpful, but I guess a little bit more about why that might be useful.
Yeah, so, people learn different skills differently, right? You're using different parts of your brain. We might use picture icons to teach a kid to communicate. We might use gestures to teach a kid how to communicate, vocal verbal language, or again, that AAC device. Each one of those impacts different, they're navigating different things with their brain, right? So one kid might catch on to one of them better than others. Mm-hmm. I will say that sign language is heavily used in, I think, special education in general. And then, if a kid can get to it, something else that's beneficial with sign language is that, again, you can teach them. It's very hard to teach vocal verbal language because you can't prompt them to say things, right? So with sign language, one, the benefits is you don't have to carry anything around with you. It doesn't have to be charged. You don't have to make specific icons. You use your hands, right? Mm-hmm. And your hands are with you all the time. So that's one benefit of sign language. And you can prompt them. If you aren't sure how to do it, right, we can kind of show you and then honor that communication so that it's more easily taught.
That's a good point. Somebody asked about, she said, thank you so much. That makes a lot of sense. Yes, we love sign language. My grandmother was a sign language interpreter for 40 years. And so I love it. I don't know very much, but someone asked, what are some things to help with sleep for those with autism? That is such a huge question. Yeah.
It is. It's such a huge question. Some things that behavior analysts work on, right? We can work on having good routines. We can kind of talk through what to do if they wake up and some suggestions there. However, I would look for a physician support too with the lack of sleep. I know that there are other interventions that can be put into place that we are not competent to prescribe or state, and we're not necessarily experts in this area.
I would say the one thing that I feel like kind of crosses over is the routine aspect
100%. And what to do.
Overstimulation.
Sure. And what to do if the child wakes up in the middle of the night and how to support there. So having a really good, consistent routine leading up to bed is really important. So whether you're using visual, like visuals to show like a checklist or going over what they're doing. But having that routine very consistently is really, really helpful. I know that there's research to support not using screens so close to bedtime.
Because that's the hard part.
Usually doing something that's really calming for that individual, right? I know reading a book seems to be a top one, or giving a bath or warm water. That can help kind of calm the system down. Mm-hmm. But yes, that routine can be very, very beneficial. If you're working on not co-sleeping, right, and a kid wakes up in the middle of the night, I know it's hard, but if you can walk that child back to their room, or you make sure that they fall asleep in the place that they're planning to sleep all night, can be beneficial, versus maybe your kid falls asleep somewhere and then you carry them into the room. If they wake up, that can be very startling and alarming and awake the system. So I think I see patience on here. I love that.
Yes.
That is helpful, having lots of patience, and really trying to get that client calm. So,
yeah. And then somebody asked, she's on her fourth overlap, or he's on her fourth overlap today, do you have any advice on the best way to build rapport with a nonverbal client?
Yeah, so every single client has very, very specific things that they enjoy doing. We also have clients that sometimes pairing looks like you give them some space. So you have to read a lot of those nonverbal cues with that child and realizing what they're enjoying. So people that have already worked with that child for a long time, and we do this with parents when we go through the intake process, is we try to learn, what does that child absolutely love, right? Usually there's a few things, whether it's being chased or tickles, or specific items, right? Or different things that you can say. My biggest thing is you're building a therapeutic relationship, so building that rapport and whatever that looks like for you and that child is really important. Please be goofy, have fun. If you're having fun, they're more likely to have fun. And if they're open to that engagement, really make all of those engagement pieces really fulfilling. Be really in tuned with their nonverbal communication, and that's a great way to build that rapport. But it's very individualized. So I wish I could say one size fits all. I know bubbles are probably the one thing that most every child loves. So that might be a good option. Water play, different sensory toys could be helpful for that learner too. So those are, singing seems to be, but the more goofy and fun you're having, a lot of times, the more fun that they'll have too.
I like that. And then it kind of this is kind of going back a little bit to the sleep thing. This is more of like a personal anecdote, I guess, but like kind of with like overstimulation. If there is like, the routine is so important. If you have like one thing or a couple things that are specifically related to sleep, it kind of puts your brain in that kind of mindset. And so it could be like something really random, but a lot of times the more calming, the better. But I feel like that's why bedtime stories became a thing too, like even just for neurotypical children, like how important that is to kind of put yourself in the frame of mind to be tired. And then I feel like also making sure, this is kind of a tip for like maybe your kid comes home really overstimulated from school, or maybe they're really overstimulated before they go to bed. Go through a checklist to make sure all their needs are met. Like, did they go to the bathroom? Did they have a snack? Did they have water? Did they do any other things that are more specific to your child? Did they do all of these things? Because something might be missing and they might not know, and then their body's freaking out and it's just telling them that. So kind of just a personal thought, but
yeah, that's great, because I can't tell you how many kids are just hangry sometimes,
right?
Too. Like they just need a snack, guys.
Yeah, there's been so many times I've tried to sleep and I can't sleep and I can't figure out why, and then I'm like, I don't feel hungry, but then I remember that I'm like, oh, I haven't eaten in the past like however long, and I'm like, oh, I need to eat, and then I go grab a snack and then I immediately fall asleep. So just some thoughts, I guess, to throw out there. Or like sometimes I will listen to a specific like video like while I fall asleep, just like on a really low volume, and then like to kind of like relax me. And then if I forget to do it one night, I like can't fall asleep for some reason, and I'm like, oh, I didn't do my routine.
Yeah, that will do it. Yeah, and then other tips too is wherever they're sleeping, right?
Mhm.
Trying not to make that room so distracting and overwhelming, right? We should have, you know, if you are able to just have that room for sleep, that's best. I know that that's not always the case, right? But if they have toys, that the toys are kind of put away and the distractions are limited, because those things will help a lot too.
Also, earplugs. I don't know, like, I know sometimes if you wear, like, the noise-canceling headphones, like, to bed, like, it might not be good for your head, but, like, earplugs sometimes really help, because even just, like, the sound of nothing can be too loud sometimes, which probably sounds ridiculous if you don't understand what I'm talking about. But if your kiddo is overstimulated and they are noise sensitive, if their nervous system is, like, kind of shot, then they might be even more sensitive to the sound of nothing. So putting some kind of like earplugs or something for if they want that can be really great. I know I've done that a couple times and it's knocked me right out. So me and my sleep, we have difficulties, but so maybe some of those suggestions will help. I don't know. But yeah, okay. And I'm trying to think, what else did we have? Okay, a little bit about, I guess, reinforcers in the clinic. I mean, reinforcement is a huge thing for ABA, for any human. If you exist, you need a reinforcer. And so kind of a little bit of context, I guess, about what a reinforcer is in ABA and how those can be used at home too, maybe.
Yeah, so a reinforcer is anything that's used to increase the likelihood of the behavior occurring in the future. Usually these things are fun for that individual. So we might be looking at something like a behavior that we want to increase, like, you know, for whatever reason, taking out the trash comes to mind. I don't know why, right? We're having our child take out the trash, they get allowance, right? The allowance is that reinforcer for taking out the trash, right? Because they're getting allowance, they're more likely to increase taking out the trash in the future. Honoring communication, right? If they're requesting for those items and honoring it, that can be reinforcing to that request. And they are so individualized, reinforcers are. So like I said, for the individual who's looking for information of how to build rapport, right? You have to know what that individual child likes, and if it's your child, I'm sure you're aware of things that they like and what they don't like. So using those things that they like and kind of presenting it to them right after they do something that you're hoping or wanting them to do. So
sorry, a little bit of interruption. We have an OT student here hoping to learn more about collaboration with ABA therapists. That is fantastic.
Yes. Yeah. Well, congrats on your journey. I hope it goes well. We absolutely love collaborating with occupational therapists. Some of those pieces that we look at the most are some of those sensory pieces for our clients, right? We see a lot of those behaviors that might just be sensory driven. Sometimes running is one of those. So collaboration can look differently. Sometimes it's meetings, just talking about kind of what barriers to learning that the BCBA is having or encountering, but also what goals that we're working on in ABA and seeing if they align with the occupational therapy goals, and just learning what they're working on in OT. I know some kids I see that are very just sensory, like they're just in overdrive, they're not regulating. So I might partner with an OT on a brushing program, or they give us tips on when and how to use a weighted vest. Other things is just understanding. Like, you guys have such a specialty in the area that fine motor and different aspects of that sensory regulation, and just learning from you guys, and then also you guys learning from us when we're looking at different challenges with behaviors and how to what we do before and after, and what our behavior intervention plan looks like. So it helps to aid in the success in the occupational therapy session as well.
So just to comment, somebody said therapists are the best people on the planet. Best wishes to y'all. Aww. Thank you so much. You really do amazing work. And then also, do you think a weighted blanket helps?
I think that is very individualized. Again,
ask the OT student.
Yeah, right? That is out of my scope. I have seen it be very effective for some of our clients with just helping them calm down. And sometimes they don't understand where their body is in space, and they need different tools to help them feel that, and that itself calms them down.
Yeah. And then the OT student asked, what do you want OTs to know about ABA?
I think the biggest thing is just understanding how our fields adapted and change. Out of all the medical professionals that, work with children, for whatever reason, I see the most OTs not like ABA. So just knowing how, we are working towards, and we do have that assent based to make sure that the client is wanting to assent to whatever we're doing. And we heavily focus on some of those reinforcement pieces to just better support the child. Know that we're open to collaborating, and we really want that. I think that it takes a village for these kids to support them. It takes the parents, it takes resources for the parents, it takes the occupational therapist, the speech path, the BCBA, the special education teacher, to all work together to know that we can make the biggest impact if we are all working together. Yeah. So
I'm kind of curious. So I know how in ABA, like, we track, the certain, like, the number of, like, certain behaviors, right? Mm-hmm. So let's say the kiddo is then going to, like, OT, for example, if they're in the same building or something. Does the tracking continue over, or how would that work?
Yeah, so we stop billing during that time. Okay. And so we don't necessarily do that per se. But, here we do have in-house another company that comes, Empower Eyes. They're amazing, and they come and do those other services. Yeah. And we talk to them, we meet, and we talk about different strategies that we use that help support them, and they implement that. If we have a kid who's potty training, now that is something that they support with. So if the kid is in underwear and we need to still go every half hour, they will help support with taking them to the bathroom. Yeah. And a lot of times they can also work on some things during that transition too.
Okay, that makes sense. Awesome. We have covered a lot of information. We go live for 30 minutes answering people's questions, and I guess we'll do one last question because you're special. Just know that. If this is a question, my son has been doing ABA since January, and we love it. Oh, yay! That's amazing. We're so happy to hear that. Sorry, I thought it was a question. Yes. That's fantastic. We love to hear it. That just makes us smile. So yeah, we will be back, I think, in we do it like every other week, usually on a Friday. So if you, we got one question on what is ABA. Want to give us a brief rundown really quick as our final?
ABA stands for Applied Behavior Analysis. So we work on using the different aspects of behavior analytic research to support learners in teaching them how to increase some of those wanted behaviors like communication, maybe social skills if that's something that aligns with the parent's goals, or play skills. And we work also on kind of decreasing some of those unwanted behaviors or interfering behaviors. Like if we have a child that headbangs or bites, a lot of times we're going to teach them how to communicate instead of doing those behaviors. So
awesome. And then the last. Sorry.
Love the interaction, guys.
I know, yeah. Lauren, I want to answer your question because that is such a huge thing we do here. Collaboration in a school setting. You're talking to the right person about that. She is so adamant and passionate about it.
Yes. So again, we all need to work together. It takes a village. We have a school readiness program here where we kind of take that child and we help bridge the gap from going on a one-on-one to using that group code and then transitioning into a school setting. So during that process, we have IEP team members come out and observe the child here. And then we have meetings with the parents, talk about a game plan, help support that IEP process. And then when they start school, we love to do observations, continue to have that open dialogue with the teachers. A lot of times we might use token boards or visual schedules, or there's just different aspects of our therapy that has really helped. Like I have and a client who started the school readiness program and vocal stemmed really loud. Well, we turned on music in the background and we were able to do that for like 2 weeks, and then he didn't need it anymore. And then he was not disruptive, very successful attending. So just small tips and tricks like that can be so helpful to share to the school team. And again, just doing those observations both here and then in that setting and home. You really get to see a fuller picture of that child and what works really well for them and maybe some things that do not work well for them.
Yeah. So she said that she was at RBT for about 2 years in a school readiness, but they didn't collaborate with the schools. Yeah, huge thing, parents. If you are, hoping to get your kiddo into school, is check out, their school readiness program if they have one, and also that they're collaborating with the school in their school readiness program. That's a huge part of that. Yeah, thank you guys for coming. We will see you guys soon. And if you missed anything from earlier, these are all posted on our YouTube channel. So look us up on YouTube, and you will be able to see the full thing. All right.
Yes. Well, thanks for laughing and learning with us, guys. Have a good one.
See you next time.